Hello everyone, this is Dr. Saroswat Devi from the platform of UKMLA with DSS. So let's just continue our counseling structures, and the topic that we're going to discuss today is the relative counseling. Okay, so yeah, there would be cases in which you wouldn't be directly talking to the patient, but you would be talking to the relative, and most likely it's going to be a counseling session in which a relative would be there. So you need to take the same counseling approach, the four box approach that we discussed in the lectures earlier on. Okay, so let's just discuss how a relative counseling session may present and what you need to do and how you need to apply those four boxes when it comes to a relative counseling. Okay. Yeah, so this is the case example that Mrs. Ali, she's a 70-year-old woman who was admitted with diarrhea. She got a CT scan done and it shows metastasis to the liver, lungs, and the kidney. Okay. She had colonic cancer 5 years ago, for which she was treated and she was declared cancer free. Okay. And then at the time of admission, she was confused. So the consultant had spoken to her daughter or son about the metastasis, and the patient has some mental capacity today. Okay, talk to the son, daughter, and address his or her concern. Okay, so first of all, you need to identify this thing as a counseling session. Okay, because the diagnosis is given. Okay, investigations are mentioned. Okay, um, the disease is already diagnosed. Okay, and a situation is there at your hand. Okay, but you still don't know and still you don't not have an idea. Okay, that what is the concern and what you exactly have to do in this particular station. Okay, like after reading this, multiple things can come in your mind that okay, she may want to talk about chronic cancer. They may want to get some explanation. They may want to ask about the repeat of a CT scan. Okay, they may want to ask about the progress of the disease. So till here you don't know what the patient wants, okay, and what the relative wants to talk about. Okay, and that is where it gets interesting and difficult as well. Okay, so as soon as you start off with the counseling station, or as soon as you start off with the session, once you are done with the rapport building, once you're done with the introduction. Okay, uh, you're going to ask, and you're going to the very first question that you're going to ask them is about, can you please tell me what is your main concern as of today? Okay, because if you wouldn't ask that, you wouldn't even know where to go, and this station would be very you would be just going very blindly in this particular station. Okay, so you have to make sure that you ask about the concern, that okay, why do you want to have a conversation? Okay, what is your main concern and what particularly you want me to address? Okay, then the first thing that you say is concern. Okay, and then the patient will, or the attendant will give the concern, and what concern they would give, it can be anything. Okay, but in this case, they would be giving the consent that do not tell my mom about her condition. Okay, like for example, she was declared cancer free, but now she has some metastasis to the liver and the lungs. Okay, and this is the news that the relative does not want her mother to know about. Okay, that is what his concern is. Okay, and then as I told you, you need to take the approach of exploring the concern. So after you got the concern that don't tell my mom about her condition, you got to ask any reason why don't you want your mother to know about this condition. Okay, and then they will give you the answer to it, that yeah, she will not be able to take this news because she also had a very tough time digesting this bad news during the time of her father's death. Okay, so now you know that the concern and why this concern is there, because this particular woman, Mrs. Ali, she had some difficulty in uh, adapting and accepting the bad news of their father's death or her husband's death. Okay, so she's also already gone through a lot of mental trauma. Her life has been like really sad, and it would be difficult for her to digest the news of her cancer being like coming back again, because she's assuming that she's cancer free. She was declared cancer free earlier on. Okay, and that is why the relative, or that is why the son or the daughter is like really concerned about it. Okay, so you're going to like explore the concern or the history of the concern. Okay, but before that, you just touch upon the idea aspect, that okay, what knowledge do you have about your mom's condition? Do you know what brought her to the hospital? What is your understanding about her condition? Have you spoken to any doctor? Do you have any idea what colon cancer is? Do you know that what type of metastasis happen? Okay, what happens when there is a relapse of this condition? What happens when the cancer gets spreads to different part of the body? Okay, so explore the idea. Okay, whatever knowledge you can explore regarding this situation. Okay, in this situation you can explore knowledge about colon cancer. You can ask about the knowledge about metastasis. Okay, you can ask about the relapses. Okay, so just try to assess how much the patient know, and ask about the fact that how much have been told to them, what conversation have happened with them and the medical team so far. Okay, and then remember I told you that there would be some occasions in which you would have to give a lot of importance to the box number one, because the concern itself would be so much that you would have to explore the concern in a lot of detail. Okay, and how you're going to do that, you're going to ask specific questions regarding the concern. Okay, this is the history of the concern. Okay, specific question about the concern, like for example, has your mom struggled with bad news before? Yes, doctor. During my father's death, it was very difficult for her to process it. Okay. How did she handle her first cancer diagnosis? She was diagnosed with cancer before, okay, 5 years earlier as well. So you can explore that, okay, how did she, adapt to it, and how did she, respond after being diagnosed with, colon cancer 5 years ago. And then they're going to say that why do you think that she cannot handle this news? Any particular reasons, any more reasons? Did anything happen 5 years ago as well when she got to know about her condition? Okay, uh, then you should know, okay, then like, are you stopping us because it's not the right time? Then what do you think, when is the right time, when should we tell her? Try to get them involved in the care. Okay, and then very very important thing, okay, these are the like couple of questions that needs to be like asked. Okay, whenever you are dealing with a relative of a patient who has a fluctuating mental capacity, you got to ask about that. Okay, are you the next of kin for this decision? Okay, or do you have the lasting power of attorney? Okay, you need to ask this question. You make sure that they are the next of kin, or they do have the lasting power of attorney, so that they can take decisions on the patient's behalf. Okay, then you're going to explore further about the concern, that has she ever wished to not know such news? Okay, did she make any wills or any wishes in the past, that okay, if anything like this happens to her, nobody should tell her? Okay, and then you try to understand more, that what will happen if we just told her about her condition. Okay, and has she made any advance directives, like the previous wills or wishes regarding not knowing about her disease? Okay, or a will that she may have made, that okay, I should not have be told about my condition. So if there is anything of that sort. Okay, so you see, there is so much detail into it. Okay, just the concern needs to be explored that much. All right, so very very important, and this is why I chose this particular scenario, because in this instead of doing the main data gathering, doing the essential data gathering in the box number two, you had to do it in box number one only. Okay, and that is what I wanted to bring to your attention, and that is what I wanted to bring in your head, that sometimes you would have to stretch box number one, and sometimes you would have to get so much deep into the concerns when it comes to the counseling sessions, that even before box two, like a lot of things in box two, a lot of parameters of box two would be needed to be assessed in box number one only. Okay, in the under the heading of history of concerns, I'll just highlight it in a separate color so that you know the importance of it. All right, okay. And then once you've asked all of these concerns, then you're going to say that, okay, any expectations you have from today's consultation, and they're going to say, yeah, doctor, my only expectation is that my mother should not know about her condition. Okay. And now, so you have done the major part. Okay, till the box number one, you have already done the major part, but the other data gathering question, they need to be addressed. Okay. Now let's just go back to the six parameters. Okay, the six important things in the box number two. Exploring the situation. Okay. In the situation, you just explore the situation at hand. Okay, that is something you've already done in the box number one. Okay, but the symptom is there. So you can just touch upon her current condition, that okay, is her diarrhea well controlled, how is she doing right now, is she having any fever, is she having any other medical symptoms, how much is she aware of the situation. Okay, just to just to basically touch upon the aspect of it. Okay, is she having very significant weight loss, is she having any lumps and bumps in the body. Okay, just explore the situation and just explore the symptoms a bit. Okay, then the risk factors or the risks, you've already explored it in the concern part when you talked about any past traumatic experience. Okay, that is one of the risk factors, right? If somebody had a past traumatic experience in adapting to bad news, that is a one of the risk factors. So we already discussed that. Then the complications as well, you have already discussed this by asking in the concern that how did she react when she heard a bad news. Okay, so you understand that the complication of the situation. Okay, the complication and the risk factor is not always about a particular disease. Okay, it's not always medical. Okay, it can be about the situation that is there at hand. All right, and you need to realize this thing. This is what the counseling station is all about. This is what counseling is all about. It's not always disease and medically centered. Okay, sometimes it's the situation. Okay, the different scenarios in which a patient may come to you, or a different scenarios that you may have to deal as a doctor. Okay, so the complication was not about a particular disease, but about the experience of adapting to a bad news, the experience of getting to know about your condition. Okay, so that is what the situation at hand is. All right, so you have already explored that. Then the psychosocial aspect, it was not explored in box number one. So you can just ask about it, that who does she live with, who is at home, anyone providing her care. Okay, and then Meftosa part, you can just touch upon it very briefly. That has she been hospitalized for a similar issues? Does she have any other medical conditions besides cancer? Because that will tell you about the disease load that patient has, and how much she has been through. And then, is she on any current medication? Is there any other family history of any other medical conditions? Okay, like apart from the father or the husband dying because of cancer. Okay, is there anything else that maybe much more traumatic and much more severe that may be running in the family. Okay, all of this thing is like important to further understand the gravity of the situation. All right, and then the examination may not be relevant in this case, because you're not uh, very much into the medical aspect, you're not dealing with the medical aspect of it. Okay, so these six parameters, out of which two to three parameters are like already very very much addressed in in the history of the concern. Okay, so you see, this is what I told, that there is no fixed rule. Okay, there is no fixed way to go about it, and this is where your skill and your flexibility needs to be there whenever you are dealing with different counseling stations. Okay, make sure that you are asking the right question at the right time wherever it is needed, as per the situation. Okay, so yeah, now comes the explanation part. So you must have seen in the test result station that we covered, the explanation was not that much in detail, and we just explained the test results, and there was not a lot of talking involved in the explanation station. Okay, but in this particular case, okay, there is a lot of explanation that you need to do. Okay, so I'm going to tell you that how you are going to explain a situation like this. Okay, let's just first read the bullet points and read the pointers that are important in a situation like this. Okay, So you gotta tell them, okay, that I do understand, I really appreciate your concern, that you are really worried about your mother, you don't really want your mother to feel something traumatic, and she's already been through a lot. So I do understand where you're coming from. Okay, but I would like to tell you that me and my team, we are trained to handle sensitive information very, very carefully. But unfortunately, we cannot hide the details from the patients, because as long as they have the mental capacity to understand and make decisions, it is a duty to be honest with them. So please understand that she has the right to be informed about her condition and make her own decisions. Are you with me on this so far? Do you have any concerns? So they'll, like, once you're explaining half of the things, you ask about the concern, and they say, "No, doctor, please don't do that. I told you that, uh, despite the fact that your team is trained, and despite the fact that she has some mental capacity, and she has the right to be informed about her medical treatment. I know that she would not process it well, she would not like it, and please don't share any information with her." Okay, so they're still going to be a bit reluctant about it. Okay, and then you're going to use more information. Okay, do not just use all the information at once. Okay, give half of the information and give half of the explanation, and then ask about it, that okay, how do you feel about this, what do you think would happen, is it okay, are you following me so far, do you have any queries regarding it. Okay, try to keep it a two-way conversation. Okay, and try to assess that okay, if they are registering what you are saying or not, and then if they don't, then use your other information that is there, your other cards that are there in your mind. Okay, then you're going to further convince them, okay, that without informing her, we would not be able to take her consents, we would not be able to do invasive investigations. Okay, and we believe that it's important for her to give her consent to do some further tests, which are very, very important in her treatment. Okay, and it's very important that she deserves to know why we are doing these tests, she deserves to know why we are doing a particular treatment. So please trust me on this. As I told you that we are like, me and my team are like trained to handle sensitive situation like this. We'll try to break the bad news to her in a very, very nice way, and in a way that it doesn't like affect her emotional well-being as much, and it doesn't affect her mental health as much, and she is able to understand the condition, and she is able to digest this bad news. How does that sound to you? Okay, so you see, a lot of things that you need to speak. Okay, a lot of diplomacy that you need to show, a lot of calm, a lot of composure you need to show. Okay, and as I told you that you would have multiple things to talk about. Like for example, in this particular case, you had the point of that, number one, your team is trained, number two, it's the right of the patient to know about her condition, get informed about her condition. Number three, you had this point that the patient has the mental capacity, so like ethically and legally we are obliged to tell the patient about their condition. Then you had the point of asking for consent, then for the investigation, then consent, and telling the patient about the complications of the treatment. So you got like 5 to 6 different talking pointers. Okay, but as I told you, do not just say all of those talking pointers like in one go. Okay, try to say half of them, take a break, let the patient and let the relative, or let the daughter or son absorb what you have said, let them understand and try to check their understanding, that what do you think about this, do you think that this particular thing makes sense. Okay, and then once they agree, it's fine, then you don't need to like worry about anything. But if they don't, then try to use your other information, and then try to use all the other pointers that you have in your mind. Okay, and how will you get that confident, and how will you get those 5 to 6 different talking pointers for all the conversation, is the only way to go about it is that you have read the notes, you have read the explanation pointers, you know that okay, what are the things that you need to use, and what are the things you need to say whenever you are counseling a relative, whenever you are counseling a patient on a particular topic. Okay, hundreds of different counseling topics, and you need to understand and you need to read all of them. Okay, do not just assume that, oh, this is just this, I'm very confident about it and I'm just going to counsel about this particular disease, I'm just going to counsel about this particular situation. No, you would not be able to counsel about it until you are very well aware of the clinical aspect, and until you have gone through the notes and you have read those things in a lot of detail. You would not be able to counsel the patient like the way I just showed it to you. Okay, so all these 6 7 pointers, they need to be there in your head. Okay, all right. Yeah, so this is the counseling, this is the concern addressing till the level of box number 3. Okay, now as I told you that the counseling session is going to be full of concerns. Okay, and they still, they may not like agree to you. Okay, so you need to be like on the top of your game. You should know, you should have those pointers in your head. Like for example, if they still don't agree that no doctor, trust me on this, it will be very difficult for her and we don't want to put our mother into this particular situation, then use this thing that I'm really afraid that if she later on learns about her condition, she may lose trust in us as medical professionals, and she might refuse any treatment that may save her life in the future. And it's very important to for us to keep things transparent, because we as medical professionals are it's our ethical and it's our moral responsibility to make sure we don't do anything that will help us harm the trust level that a patient has with the doctor. Okay, so try to use all of those things, and it would keep on getting difficult for you. Okay, still the patient or the relative, they won't agree. They may say that, okay doctor, can you just please tell her that it's just a small mass of cells, and do not use the word cancer. Okay, and then you gotta say that no, we need to give the clear information, we cannot alter the information. Okay, we must give exact diagnosis. Okay, we cannot just change the diagnosis, and it's not ethically correct. Okay, and then finally they will start agreeing to you, and then still again they're gonna give you a concern, the doctor, okay, can I just be there with you while you tell her? Okay, so don't just instantly say yes, yeah, sure doctor, yeah, sure, you can be there when I discuss the bad news. Do not just directly say that and agree to that. Okay, say that if she wishes for someone to be with her, and we're going to ask her, and if she allows someone, because the patient in this case, she has the mental capacity. Okay, see, she has the mental capacity, you need to understand this thing. Okay, if the patient has the mental capacity, then the consent of the patient would prevail first, and then any next of kin or any lasting power of attorney. Okay, so you gotta say that, okay, we are going to ask her, and if she wishes, then definitely like you can be there with with her, while me or my team member, while we break the bad news to her. Okay, so yeah, concerns, and that is why I say C for counseling and C for concerns. Okay, concerns will keep on coming to you again and again. Okay, so you should be mentally prepared for that. All right, yeah. Then the possible advices, you can provide psychosocial support to the mother, psychosocial support to the family as well. Okay, it's a traumatic news. A referral and admission, oncologist, general surgeon for second opinion if it's needed, but it may not be needed. Okay, the management pointers. Okay, well, it's not. It wouldn't be very like heavily tested, but you can just like after you are done convincing them, you can just share the idea that, okay, the oncologist or the general surgeon are going to see your mother, and they may want to go for surgical resection, they may want to go for chemotherapy or radiotherapy, or if they feel that the prognosis is not good, which means that any medical intervention would not do much benefit to your mother, then they may put your mother on something called the palliative care. Okay, but all of these things are like going to be very basic and very superficial, because the main part is the concern and the main part is box number 3. Okay, so you may not always go to box number 4, and I told you this, that sometimes uh, all of the things would be addressed in box number 3 only. Okay. Now, a few important pointers that I would like to discuss, because in the relative counseling, there is a very strong possibility that the patient may not have mental capacity. Okay, so number one, if the patient has mental capacity, and if the relative is coming there to talk to you, then you have to make sure as a healthcare professional that the permission have been taken to talk to the patient or talk to the relative. Okay, so if the patient has mental capacity, like in this case, you have to see if the permission have been taken. Okay, like for example, in this case, the permission has been taken to talk to the son. Okay, you gotta check that if the patient has the mental capacity. Okay, so that is one scenario. A patient with mental capacity, you're going to talk to the relative only if it is mentioned that the permission have been taken. If the permission is not taken, if it is not written over here in the in the case notes or in the task, then what you gotta do is that you gotta ask this thing in the first box only, that do we have the permission to talk to you, or has your mother given the permission to you to talk to me about her condition. Okay, so always make sure that the patient with a mental capacity have given the permission, number one. Number two, for those patients who do not have the mental capacity, okay, then there are three things that you should be aware of. Okay, the first thing is called the advanced directive. Okay, so advanced directive is basically for those patients who have made some wishes, and they have mentioned about some treatments that they do not want. Okay, if they lose the mental capacity. Okay, let's suppose that our relative comes to you, and they are demanding a particular treatment for their mother, or a particular treatment for their relative. Okay, so before agreeing to that, or before saying yes, we can offer this particular treatment, or we can offer this particular investigation for your mother, you got to ask about that. Did your mother sign any advance directive to refuse treatment while she had the mental capacity? Okay, and if they say, yeah doctor, they yeah, she did sign an advance directive, then you got to see if the patient made any any legal binding to refuse a treatment. Okay, and see if the patient actually wanted that particular treatment, or wanted that particular investigation, or wanted that particular care or not. Okay, so you got to ask about this. Did your mother sign any advance directive? Like for example, in this particular case that we discussed today, maybe the patient had signed an advance directive on the right not to know what her diagnosis is. Okay, and if this was the case, and if this patient did not have the mental capacity, then you would have agreed to the relative, because the patient had an advance directive. Okay, so you need to make sure that you have uh, asked about the advanced directive. Okay, then the next thing is about the lasting power of attorney. Okay, uh, you if somebody doesn't have a mental capacity, and their relative is coming to you, okay, then you got to see that, okay, if they have the lasting power of attorney, which is basically a legal document that allows a particular person, it can be their relative as well. Okay, to take the decisions on behalf of that particular patient, when the patient doesn't have the mental capacity. Okay, so you're going to ask, okay, all right, you are here to take the decisions on your relative's behalf. All right, you want to decide this particular thing for your mother, for your father. Okay, but can you please tell me, if you have the lasting power of attorney? Okay, or are you the lasting power of attorney, so that we are very clear on the fact that you can make decisions on their behalf. Okay, that is one scenario. And the cases in which the patient doesn't have the lasting power of attorney, okay, the patient did not assign someone as the lasting power of attorney, the patient did not sign any advanced directive as well. Okay, in situation like these, what you need to do if you're talking to a relative who of a patient who doesn't have a mental capacity, and they don't have an advanced directive, and they don't have a lasting power of attorney, then you got to ask that, are you the next of kin? Okay, so who's the next of kin? Next of kin is basically the closest relative of the patient. Okay, and in case if there is no previous legal binding, like for example the advance directive or the lasting power of attorney, then the next of kin automatically gets the legal right to make medical decisions. Okay, unless they hold an LPA, or unless somebody else holds a lasting power of attorney. Okay, that means that the person with the lasting power of attorney would have the right to take the decision. But if nobody has the lasting power of attorney, then the person who is the closest relative, okay, that is the blood relative. Okay, like for example, if there are three relatives standing, if there is a son, if there is a cousin, okay, and if there is a husband, okay, then the husband would be the next of kin. Okay, after the husband, then the son would be the next of kin, and then after the son, the cousin of that particular patient may be the next of kin. Okay, so whoever is the relative that is closest to the patient, and if they are alive, they have the automatic right to take the decision on the behalf of a patient who doesn't have the mental capacity. Okay, so why did I teach this thing? Because whenever you are dealing with a situation like this, whenever you are dealing with, and whenever you are talking to the relative, okay, you have to make sure that you assess, number one, whether or not the patient has the mental capacity. Okay, and if they have the mental capacity, they have given the permission to the relative to talk on their behalf. Okay, and if they don't have the mental capacity, see if they have an advanced directive. Okay, if they don't have an advanced directive, the next step that you need to take is to see if the person that is talking to you is the lasting power of attorney. Okay, and if they do not have the lasting power of attorney, and if there is no lasting power of attorney, then you got to see that, okay, who is the next of kin. Okay, so all of it needs to be done in box number one. Okay, before starting a conversation with a patient, before starting a conversation with a relative, make sure that you have addressed all of these things, and make sure that you have identified that you are talking to the right person, and that particular person has the legal rights to talk about their relative condition. Okay, really, really important concept that you need to understand in all the relative counselings. Okay, that's it, pretty much it from my side for today's lecture. And regarding the relative counseling, if you got any queries and any questions, then please drop them down, and we'll discuss the other counseling structures in the upcoming lectures. Okay, so see you in the next lecture.